name is Nicole Adams, and I'm a representative with MedImpact, and I'm here today to talk to you about your prescription drug benefit. Now, as your pharmacy benefit manager, MedImpact works with PEEHIP to ensure that we provide you with appropriate, affordable healthcare options while also trying to manage those drug costs. Now, this is done by establishing a list of preferred products, also known as your formulary, and we also use clinical tools such as step therapy. Now, when you return from break, you should have found 5 documents on the table on top of your folder that I'm going to be discussing today. And the first document is labeled October 2012 Prescription Drug Changes. And so, as many of you are aware, the PEEHIP board does meet twice a year to review any proposed changes, and this also includes the prescription drug changes. Now, all of these changes will go into effect October 1st of this year, and any person that is impacted by these changes will be sent a letter letting you know that you will be impacted. So the first page of this document details the changes that are going to be made to PEEHIP's formulary. Like the handout mentions, the formulary is a drug list that helps determine the copayment for prescription drugs. So you are always going to pay the lowest copayment with a generic medication, followed by a preferred or formulary brand, and then the highest copay will be the non-preferred, non-formulary brands. All right, so there are going to be 5 brand drugs that are currently preferred and on PEEHIP's formulary that are going to be moving to the non-formulary status, so they will no longer be preferred products. They will still be covered, but you will have a slight increase from $40 to $60 in the copayment. The handout too does mention Tier 2 alternatives, which those are the preferred brand drugs. So if you're taking one of these medications, then do take a look at the alternatives. Take this handout to your doctor, see if this is something that maybe you can switch to, so you can either continue paying that preferred copayment, or there are some generic alternatives for some of these, so you can even lower it even more. But with that, there are going to be 3 brand drugs that are currently not on PEEHIP's formulary that will be moving to the formulary and preferred status. So if you were taking one of these medications, then you will see a decrease in your copayment. There's also going to be 1 medication that will no longer be covered under the prescription benefit. This is simply because it's administered by a healthcare professional, and so you will get that through your doctor's office. So it'll be covered under the medical benefit. So it's still covered by PEEHIP, it's just a different avenue of how you would get it. So you get it at the doctor and not at the pharmacy. Okay, the second page of the handout outlines the changes to the step therapy drug program. Now, the PEEHIP board did approve the deletion of 1 step therapy program. 3 new were added, and then 4 existing programs will have changes made to them. But anybody that has taken any of these medications currently will not be impacted by these changes. You will be grandfathered in and are not subject to the step therapy requirements. So this is only for new starts. All right, the third page details the changes to the prior authorization and quantity level limits program. And now, just to explain the intent of both these programs, it is strictly to enforce appropriate use of medications. And this is based on FDA recommendations and also guidelines by the manufacturers who actually study and create these drugs. So it's not to create any extra work for you or your physician, or to question anything that your physician has chosen for you. It's simply just to make sure that it is being used appropriately and not for unapproved off-label use. All right, so effective October 1st, there will be 21 new drugs that will be added to the prior authorization program. Again, members taking these medications will be sent a letter October 1st as well, or prior to October 1st, and your physician will be sent a letter also. Now, I just really encourage you to read this letter carefully, follow the steps that need to be taken. You need to work with your physician in order to get that prior authorization, because October 1st, we don't want to have any disruption or delay to the pharmacy. So if you have any questions about it, there will be information on that handout that you can call. Now, as for the quantity level limits program, there are going to be 10 new drugs that will have quantity limits applied to them. And again, these are still just based off of FDA recommendations. Now, PEEHIP and MedImpact do understand that there are always extenuating circumstances, and sometimes you may need to take a quantity of a medication higher than the limit that is set. Now, if this is the case for one of these medications, the letter will explain the steps that need to be taken in order to get an exception granted. If you are not taking a quantity higher, then this will not impact you. All right, and then on the same document, the last change will be changes to an age requirement will be put on 2 medications. In your packet, you also received a revised PEEHIP preferred drug list. Now, please note that this is an abbreviated list, so if you have a question about a medication that is not on there, you can go to our MedImpact member website, or you can also contact our customer service that is available 24 hours a day, 365 days a year. Both of those information are on the back of your insurance card, as well as on the inside of the handbook that you received, the PEEHIP handbook. And I do want to mention that we also have a MedImpact representative that is on site Monday through Friday at the PEEHIP office. So if you're calling PEEHIP for anything else, and you also have a drug question, you just ask to speak to them. Or if that's just a number that's easier for you to call, then again, you're more than welcome to call. In the packet, you've also been provided a copy of PEEHIP's maintenance drug list. Now, the maintenance drug list is a list of medications that are eligible for a 90-day supply for 2 co-payments versus 3. So if this drug is on this list, what you will need to do is talk to your physician and have them write the prescription so that it is dispensed at a 90-day supply. Otherwise, the pharmacy will continue to bill it for 30 days, and you'll be charged a copay every month. So over the 3 months, you're paying 3 versus the 2 that you could pay when you fill the 90-day supply. Now, also, in order to get a 90-day supply, you do have to have at least a 30-day supply in the past 130 days. So if you've had a break in coverage, or maybe it's a new medication that the physician is trying you on, you do have to get a 30-day supply first before you can get a 90. And this is just, to make sure that this is the medication, the strength that you are going to be taking. So once that's been established, then you can get a 90-day supply. All right, now the last 2 documents in your handout are some frequently asked questions about some of the step therapy programs, and also the prior authorizations and generic versus brand medications. So I do want to encourage you to read these documents as well, and just to become familiar, with some of the clinical tools that are in place. Because by understanding your drug benefit, then you do experience, less frustration, when you go to the pharmacy and are told that maybe a drug requires prior authorization, and then at this point, you just need to know the steps. So I really do encourage you to read those documents. Again, if you have any questions, our customer service is available 24 hours a day, and we do have that on-site MedImpact representative. So please feel free to utilize those resources.